Good morning, everybody. Myself is Professor Dr. Deshpande. We are in the Ayurveda College, Nigdi, Pradhikaran, Pune 44. With me are my PG students of Ayurveda who are doing the MD in Ayurveda. Today is a Tuesday, that is 7th of August 2018, and topic will be Ayurvedic treatment of bronchial asthma, part 3. Ayurvedic treatment of bronchial asthma, that is the Schwas in Ayurveda, part 3. Not only Schwas, but actually I can say the Tamak Schwas. The specific word is Tamak Schwas. So, today we are again little bit rewinding what we have already seen, and we are adding some information, especially concept of the etiological factors and the pathogenesis as well. And then we will go for treatment. So, when we talk about the treatment, first, I think before the treatment I can go for little bit behind regarding the introductory part of the Schwas Vyadhi or the bronchial asthma. As you know very well, what is the types of the Schwas Vyadhi mentioned in Ayurveda are 5 types. That is Maha, Urdhva, Chinna, Tamak and Kshudra. These are the types of the Schwas Vyadhi mentioned in Ayurveda. But we can say at a practical level, these are not the same disease. These Mahashvasa, Urdhvashvasa, Chinnashvasa, Tamakashvasa and Kshudrashvasa are totally 5 different diseases. And they have one common feature, that is Shvasa. That is, in everything there is a difficulty in breathing. Dyspnea is there. So these are the 5 separate diseases having the symptom of dyspnea, because each Shvasa, Maha, Urdhva, Chinna, they have the different causes, different clinical features, different pathogenesis or the Samprapti, and of course the treatment is also different. But in general, how they have described the Madhav Nidan especially, what is meant by Shvasa? So they say, they have compared it, Shvasastu Bastrikadmana Vat Urdhva Gamita. Shvasastu Bastrikadmana Sama. So these are the Sanskrit words. But what is meant by Bastrika? It's a pump blown by the blacksmith. लोहाराचा जो भाता असतो, इन मराठी त्याला लोहाराचा भाता म्हणतात. तर तो लोहाराचा भाता जसा आपण पंप केला, when we pump that blacksmith's pump, the similar is the feature that is taking place in the bronchial asthma. The patient feels difficulty in expiration. So it's like a very harsh and strong respiration. Respiration is always increased, rate is always increased. RR normally is a 14 per minute. Then it becomes 30 and then it becomes 50 also. So the pumping is increased and it is compared with the blacksmith pump. So there is also sound is created, and that we call as a whistling sound or the whizzing sound because of the spasm of the bronchi during the expiration. Then in Charak Chikitsasthan chapter number 17, Charak Chikitsasthan chapter number 17, there are different causes are mentioned. There are different causes are mentioned regarding the Shvasa Vyadhi, Tamak Shvasa, as well as Pranavah Sroto Dushti. So I am going to revise that causes and I am going to translate those causes. This is like the checklist. When you examine the patient, you have to check whether this cause is there, yes, no. Whether this cause is there, yes, no. So you make a list of nearly 20 causes according to Ayurveda. According to modern science, it is only one cause, that is allergy or hereditary, finish. But Ayurveda has given in detail what are the possibilities to develop the weakness in your respiratory tract, and that is adding the pathogenesis of your Tamak Shvasa or bronchial asthma. Number 1, Rajasa Dhumavata Bhyam. So Rajasa is Sanskrit word. Every time I am translating in English, dust. Raja, dust. Dhuma, fumes. So whether your bronchial asthmatic patient is exposed in day-to-day life to the dust or to the fumes in excess, that can make his pathogenesis or pathology more problematic. His treatment will be difficult if he is exposed to the dust and fume every day. That can be compared with air pollution. So air pollution is mentioned as a cause of Schwas in Charak's time. And which are the words? Rajas and Dhuma. Third, Shita Sthana. Third cause. Shita is a cold. So Shita Sthana, staying, living, spending much time in cold atmosphere. So cold atmosphere is not very well for bronchial asthma. Always remember, sitting, working in the air conditioned room, in your house also, in bedroom, in working room, dining room, if there is AC, that is problematic. Especially cold weather I am talking about. Shita Ambu Sevana. Next cause is, according to Ayurveda, Charak, Shita Ambu Sevana. Ambu is a water, but we can include all beverages, all liquid items which are having cold in nature or cold to touch. Cold to touch. So naturally, all cold drinks are bad, are the causes of exacerbation of bronchial asthma. Modern science believes that bronchial asthma patient has remission and relapse. So they don't find why there is a relapse. We have the causes. So you just check it out. You can directly ask him whether you have drink something cold. You have ate the ice cream today or day after last yesterday. He says, oh yes, I have taken. Then that is the cause of exacerbation according to Ayurveda, and it's practically proved. So Shita Ambu Sevana. But there of course you can add the cold foods as well. That means the freezed items. Vyayamat. This is one of the reasons. Sanskrit word is Vyayamat. It can be translated excessive, beyond limit, taking or doing the exercise. Too much physical strain. In the word Vyayam, I am not translating only exercise. What I am translating? When Vyayam is mentioned as a cause, it should be excess. And not only exercise, but any physical activity in excess will be cause of the exacerbation of bronchial asthma. मराठीमध्ये आपण त्याला दगदग म्हणतो. When the patient gets physical stress, he will suffer. Maithuna, next cause according to Ayurveda, very interesting. Modern doctors, they will not believe, but it's a fact. Excessive sexual indulgence. Even many doctors will be getting awkward to ask this question, but you must ask, how far is the physical activities? If it is more than the limit, as per his prakruti, as per his biotype, as per the season, then that may be the cause of exacerbation of bronchial asthma, Vegavastha. And research should be done on these points. If the modern physicians are challenging this point, they can observe, they can note this point, and then we can say yes or no. Rukshanna Sevana. Ruksha Anna Sevana. Taking the food absolutely of dry quality, dry. While eating, not drinking a single amount of water. No curry, no buttermilk, no liquids in your food is very problematic. Absolutely not taking any one drop of milk, not a single spoon of ghee, that is bad for the health, remember. So snigdha, anxiousness is essential for the body. So if you are eating all the day only vada pav, sandwiches, only dry food, not regular our Maharashtrian thali, chapati, rice, curry, vegetables, all should be there. But if you are eating only living on the external foodstuffs like the bhel, vada pav, samosa, bakery products, then that can be the ruksha anna sevana according to Ayurveda. Vishama ashana, vishamashana, taking incompatible foodstuff, viruddha anna, The commonest examples are milkshake, any pomegranate, orange, chikku milkshake, apple milkshake, whatever it may be. Because any fruits are supposed to be acidic and milk is supposed to be alkaline. So they don't match with each other. So Ayurveda believes that mixing the fruits into the milk is not good. Commonest is a shikran in Maharashtrian food. Banana and milk is always taken together. That is not allowed according to Ayurveda. If I want to give the young generation's food stuff, they eat always hot chocolate with ice cream. This particular combination is also not accepted by Ayurveda. That means if it is taken frequently, then that can be the problem for asthmatic patient. Asthmatic patient should not go for this particular recipe or the dish. Hot chocolate with ice cream is not good for him. Basically ice cream is not good. Then you are pouring the hot chocolate on it. So it's a combination of hot and cold, that is called as a viruddha anna according to Ayurveda, incompatible food. In foreign countries, in Germany, I have observed, they always take coffee and ice cream together. You will not believe, not mixing I am saying, but one cup they drink 2 or 3 sips of the coffee, 1 or 2 spoon of the ice cream. That I have observed. So coffee is hot, ice cream is cold. So that is also viruddha anna according to Ayurveda. Yogurt at night, curd. In India we call it as a curd. In the Europe, in America there is yogurt. Taking at night is not good. Even ice cream, ideally it can be taken by normal person even in the summer season. It is accepted for the normal person. But nowadays even healthy person, these all the fruits and ice cream are eaten throughout the year. Whether it is raining outside, whether it is cold outside, they have the party of ice cream. So that is something not accepted by Ayurveda, especially asthmatic patient definitely will get the problem if they do this type of the mischiefs. So rainy season and cold season is not favorable for ice cream. Then amotpatti is one of the reason given in the by Charak. So this amotpatti, is a toxin, undigested material in your body because of the faulty primary digestion or faulty metabolic processes, metabolism. And which are the reasons for amotpatti or ama formation, toxin formation? Indigestion with constipation. Indigestion with constipation is a very good source for the ama. Eating heavy food stuff, difficult for digestion, like cheese. There is now in the higher middle class or higher income group, there is always a cheese in their fridge. Commonly used, sausages and cheese are very, very common in a even middle income group and higher income group. It is routinely used. For asthmatic patient, it's like a poison. So don't cheese, do not eat the cheese. Fast food contains a lot of ama. It can create ama in your body, fast food, because they have a lot of preservatives which are not good for your health, and they are instant food, so their original natural, what you can say, the qualities are destroyed by the freezing process and salting process. So fast food is not allowed. Instant vegetable, instant chapati, anything instant is not good for asthmatic patient. They should eat the homely made, normal, freshly cooked, warm food. Then inorganic food, especially food, vegetables, rice, wheat, farming is done with the pesticides and insecticides or the fertilizers which are non-organic or chemical fertilizers are all bad for the asthmatic patient. Nowadays even India, like the foreign countries, now organic shops are available. There you can get especially typically food prepared with the organic farming. So organic farming is very essential for the asthmatic patient. Next cause mentioned by Charak is Raukshat. Raukshat means is not only food, but whatever the things which can make your body dry. Your body organs can become dry. There will be less mucus secretions all over the body. Shleshak cough Synovial fluid will be less, cerebrospinal fluid will be affected. Quality, I am not saying quantity. So quality of all body fluids will be affected if you follow the excessive dryness lifestyle. What can make your body dry? Number one, smoking. Smoking can make your body dry. Remember, not only lungs, but whole secretions will be absorbed according to Ayurvedic philosophy. Mental stress can make your body dry. Loneliness, even in India, it is now increasing problem. People are living in a, what you can say, the pseudo atmosphere. Social media is not a really affectionating with each other. They are not really binders. They are very pseudo binders. So people, although he is having a lot of friends on the Facebook, but for personally himself, he always feel depressed. Why loneliness? That is because our families are become nuclear families. We are losing our relations. That can be a cause, according to Ayurveda, for the asthmatic problem. Rukshata, dryness, can be increased by keeping late at night. If you make the habit going to the bed very late, midnight, that is very bad for the asthmatic patient. Your food diet is without milk, without ghee, without liquidity, liquid foods, that can make your body dry. Next cause mentioned by Charak is apatarpana. Apatarpana. Apatarpana is a degeneration, catabolism. Apatarpana is a degeneration or the catabolism. What can make this excessive fasting is one of the reason. Dieting. There is a craze of dieting, as I already discussed. So this is very bad for asthmatic patient. Anemic condition is bad for the Pandu, according to Ayurveda. This is apatarpana. This is cause of the bronchial asthma. So if the bronchial asthma has a less hemoglobin, you first correct the hemoglobin, automatically his attacks will be reduced. Three dhatus are very important for apatarpana. You have to be very careful about rakta, mausa and asthi. You must check the dhatu sarata of these three dhatus for the bronchial asthma. Rakta dhatu, that is blood. Mausa means muscles, can be judged by your weight. Asthmatic patient should maintain his normal weight as per the height weight ratio. Remember. And asthi, that is the bones. He should also maintain the quality of calcium and phosphorus in his body. Then only his vyadhik kshamatva will be well, and there will not be any apatarpan or degeneration or catabolism. Then there is another reason is about udid. Some pulses or grains are mentioned as a cause of bronchial asthma. In Marathi, they are called as a vatul padartha, which can disturb your digestion, forms lot of gases, and most of the things are the beans. Pauta, udid. So these type of beans are very heavy for digestion, and then they can create the gas in the stomach, and that is very bad for the asthmatic patients. Then they have mentioned about guru. In the cause, guru padartha, heavy for digestion. So high calorie diet, fatty diet, or high carbohydrate diet. So excessive fried food are very bad. When the oil, whatever the oil you are using is too much in your curry or in your vegetables, that is bad for asthmatic patients. Like dryness is bad, as well as excessive oil is also bad. Remember, I am not talking about ghee, I am talking about oils, and especially for cooking purpose. In foreign countries, we are stressing about the non-vegetarian food. Non-veg food is in general not very good for the asthmatic patients because it is heavy for digestion. It is heavy for digestion. Especially in Germany, we always talk of white meat and red meat. So red meat is toxic. It is heavy as well as it creates the ama in the body. Red meat. So what is the form of the red meat? First I will give in German language and then I translate in English. Schweine. Schwein is a German word, that is pork. Schwein in German, pork in English. Rind. Rind in German, beef in English. And Lamb, L-A-M-B, in German, and lamb in English. So, pork meat, beef meat, and lamb meat are not recommended for bronchial asthma patients. Eating excessively sweets, especially German people, they are very fond of cakes, ice creams and chocolate. So cakes, ice cream and chocolates in excess is definitely bad for asthmatic patients. Especially when we have to check also the Agni, because Ayurveda says these foodstuffs are heavy for which patient? For the Mandagni patient or Vishamagni patient. Remember, if the asthmatic patient is having Pitta Prakriti and he has very, very strong fire, some indulgence, some mistakes are acceptable. But basically who has Mandagni, he will not be able to tolerate these things and he will get the attack. Then in heavy thing or as a cause, Jala Anupa mouse, that has mentioned in Charak, Anupa mouse, especially fish, is not recommended for two reasons. One is water content and another is the salt content. So water and salt content can increase the kapha dosha, and that is not good for bronchial asthma. All Abhishandi foodstuff, Abhishandi means bakery products or South Indian dishes, fermented products. We have already discussed about it. Yogurt, curd, uttappa, dhokla, masala dosa, all these South Indian, they have prepared by fermentation. And Ayurveda believes that fermented process also can set into your body. If you take this food, it's like a bubbling, it's like a excessive secretions, mucoid secretions, serous secretions, and that can block your digestive tract as well as the respiratory tract. We are not thinking about only sthula srotasa, because the listeners may suspect, is it that much mucus that will totally block the bronchi or the alveoli? It is not. Sometimes it can be bronchiectasis or some patient have the huge sputum. But I am not talking only on the gross level. I am talking about the cellular level. And when we talk about cell wall transport, that is Sukshma Srotasa in Ayurveda. What is Sukshma Srotasa? Again consider the alveoli. There is a surrounded by the endothelium of the capillaries. So that wall becomes the choked, obstructed, naturally exchange of gases will suffer. And that O2-CO2 exchange will suffer at the level of alveolus. That blockage is also included according to Ayurveda by eating the Abhishandi Padartha. Because the gross medical doctor, the object, GI tract is so big, esophagus is so big, duodenum is so big, how you will say it is obstructing? So for them you tell that we are talking about not only gross srotasa, but sukshma means minute channels. And which are the minute channels? Where ionic exchange take place. This language is very well understood by the modern doctors. They know the cell wall permeability, cell wall transport. They have learned it. Active transport, passive transport, NAK pump, everything they know. So that what I am mentioning, that NAK pump will be get blocked. And there will be excessive hyper activation of that particular cell. Hyperpolarization. And that can disturb the physiology. Do you understand what I mean? Okay. Next cause mentioned is a Shleshmalanam cha sevanat. Shleshmalanam cha sevanat. Shleshma is a cough, bioenergy. So Ayurveda says the food stuff or the activity which can disturb the kapha bioenergy, that are the causes of asthma. Which are the taste of the food that disturb the kapha? Madhura, amla and lavana. Excessive sweet, excessive sour, and excessive salty. If the patient is taking, that can disturb again the pathophysiology of GI tract and respiratory tract. Excessive sweet, what does it mean? Every day if you are taking the jalebi, for example, jalebi is a sweet available in the Indian market, in Maharashtrian market. Then gulab jam, every day, basundi. I know that everybody is not taking this much sweet every day, but yes, you can search these patients. These patients can happen in a society that they have the habit. I am not talking about this secondary glucose, that means whatever the glucose in the wheat and rice, that is not troublesome. But if you get the direct glucose which is included in the sweet, that is troublesome. So we have to be cautious. Amla, what is amla? Pickles, we are talking about the pickles, raw mango pickle. This is very bad for the asthmatic patient. And what is meant by excessive salt? Some people are a habit to putting the salt again while eating. That means in their vegetable there is already we put the salt. In curry we have already put the salt. But I know especially in the Vidarbha, in Maharashtra state, there are some people who have the habit of putting again salt on everywhere. That means curry, on the vegetable, they put extra salt. Then nowadays, lot of your chips are made up of this salt. Every preservative has a lot of salt. So every fast food has a lot of salt. So when you bring the packet from the market, ready-made, ready to cook, any packet, curry packet, roti packet, vegetable packet, 100% there is excess salt. Remember my words. So people are not knowing this fact. They say, no, I am normal, I don't eat the salt. Even my dish, food dish, lunch dish, I don't take the salt. They have misunderstanding, only that table salt is a salt. But so many things are there in the society, especially ketchup, tomato ketchup. Any sausages, remember my words, any sausages. So ketchup and sausages have a lot of salt. And there are so many people. Take the sandwich, put the sauce. Anything, excess, salt. So sauce and these things make you the problem of the, not only murmure, churmure and kurmure. You tell me the names of the latest things, that wafers you are eating. Tell me, come on. So that I can record those things. Loudly, please loudly. Kurkure I know, anything else, any product else. Kurkure is very famous. So Kurkure company will be object for me, what I am saying. But we are talking about asthmatic patient. So these people should avoid this type of the salty consumption. Okay, so most of the things we have cleared up. So many modern physiologists and medicine people, they will say, sir, whatever the causes you are mentioned, how they can be the direct cause of the asthma? Because we don't agree with these your statements. So for them, my statement is, these all the things according to their language is called as a predisposing factors. Then they will accept. Okay. Predisposing factors, according to Ayurvedic language, can be converted as a stroto vaigunyakara. Stroto vaigunyakara. And one day when there will be cloud outside, he will start the attack. But before that, he has already weakened, W-E-A-K-E-N. He has weakened his respiratory tract and GI tract because of all these causes. So tell your modern colleagues, modern counterparts, that these are the causes that asthmatic patient should be care of. If he wants to avoid the recurrence, if he wants to avoid the vegavastha, relapse, exacerbation, he can control on these factors. Modern doctors, they don't go into details. They only say clean air, no smoking, don't go into the crowd place, that's it, 1, 2, 3. But we have the list of 20 things. This is called as a checklist for the asthmatic patient. This research language you should have in your mind. Checklist, give this pamphlet into the hands of the patient. What doctor can do, they can type it, they can make a DTP, they can print this pamphlet and give it to the patient and say, whenever you consume any of these things, make a tick mark and put a date in front of that and tell me, when you come next time, always bring with you. So you will find out that before the attack, he has consumed these things for 7 times. Then he also will be, it's called as self-analyzation, self-analysis. In foreign countries, remember my words, in Europe, in America, there is a trend that doctor should train the patient about his illness. patient's education is a must expectation by a doctor in the Europe. You must train the patient. So in this policy is not adopted too much in India, but you can adopt on the base of Ayurveda. After preliminary causes, again after detailed things, we will little bit talk about the pathogenesis or Samprapti. In today's lecture, we will only concentrate on causes and Samprapti, and next lecture will be regarding the direct some medicines. Because pathogenesis is also little bit different than the modern pathology. Modern pathology, they concentrate only on the respiratory tract. They always think of stimulus. They only think of allergy, allergen. Then they think of, you know this word, allergen? Allergen is a protein coming outside and you are creating the antibodies, fighting material. So whenever you are exposed to the pollen grains, for example, when you are exposed to the eggs, for example, when you are exposed to the groundnut, shengdane, for example, if you are exposed to the fish, so these are, according to modern language, allergens. And then there is a reaction. What is the reaction? Antigen and antibodies. So allergen is equal to antigen. Allergy or allergen. Remember, these are the different words. Allergy is a situation. Allergen is a substance. Allergen is equal to antigen. When it will enter into the respiratory tract from nose, going down to the pharynx, going down to the trachea, primary bronchi, secondary bronchi, tertiary bronchi, terminal bronchioles. At any of these places, it can start reacting with the cells over there. Then mucous membrane, there will be glands. Some cells, they will secrete histamine, because who is the soldier in our body? WBCs are the soldiers. When antigen will come, these cells are everywhere, you know. These cells are in the blood, and blood is everywhere. Blood is in the bronchi, blood is in the alveoli. So in the blood there are WBCs. They will immediately get up. Okay, antigen has come, allergy has come, let us fight. So eosinophils will be more secreted. They will be rather not secreted, they will be developed. And from eosinophil, histamine will be secreted. And that histamine, what is for the secretion purpose. They will create a lot of secretions. What is the purpose of secretions? To wash out. To wash out the antigen, and they throw it to the lymphatic circulation. They are washed away. Antigens are washed away. Allergens are washed away with the histamine. But what is happening? Sometimes they are so, what you can say, enthusiastic. Eosinophils become more enthusiastic. And that histamine sometimes be problematic to that patient. So much reaction is there, fighting is there. And so doctors are recommending antihistaminics. So you will say, sir, one side you are saying histamine is good, other side doctor is giving antihistaminic. What is that? Do you understand what exactly happening? Actually, histamine is a protective mechanism. But especially when the acute attack is coming, that fighting is so much strong that doctor has to control, okay, don't fight. We will give the bronchodilator. He will be comfortable, don't worry. I will add a little bit steroid, so the cellular inflammation will go down. So this is a type of, again, yukti pramana according to Ayurveda. So on the one side, histamine is good at some level. For example, just make a level for 1, 2, 3. So at one level, 2 level, it's okay. But if it is above 80%, above 90%, that can problematic to that patient itself. Do you understand? And that is called as a reaction. And allergic reaction, what we say is the allergic reaction is nothing but the histamine reaction, and that's why doctor giving the anti-allergic means antihistaminic. CPM, in our days we have to use to chlorpheniramine maleate is the name, CPM tablet. Nowadays what we are using? Simple drugs, Lorfast, loratadine. What else? Cetirizine. My popular brand is Instead L. There are some. Every doctor has his own brands. But what I mean to say, Ayurveda do not concentrate only on the respiratory tract. Ayurveda has a different aspect looking towards the pathogenesis of Tamak Schwas or bronchial asthma. After direct contact of the the Hetu 7 according to Ayurvedic language, exposure to the causative factors. Again, you divide the causative factors in two ways. Some causative factors are making the Stroto Vaigunya and another causative factors are making Stroto Dushti. Am I right? For example, eating sweets, eating carbohydrates all the time, that can be the predisposing factor. But exposed to the crowd, exposed to the too much fumes, do you understand? Exposed to, that is the acute cause. That is a Stroto Dushti cause. So Stroto Vaigunya making you weak. Respiratory system immunity is weak. And then you are exposed to the actual causes. Then it starts the disturbance in your metabolic process, GI tract problem. There is a Kledak Kapha according to Ayurvedic language, and that central Kledak Kapha is a king of all the Kapha in the body. According to Ayurvedic language, Kapha is everywhere, in every molecule. Kapha is everywhere. This is the bioenergy. Do you understand? From head to toe, everywhere there is a kapha. But where is a central head office? Head office in the stomach. Adho Amashaya, Urdhva Amashaya and Adho Amashaya. So everywhere there is a kapha, and that central kapha is getting disturbed because of your faulty lifestyle. And that kapha makes the problem, it has like a remote control. Sensors are there. So other kapha also gets disturbed because of the damage to the central kapha. Why? Because it is creating some arm. When central kapha is damaged, it is creating some toxins. They are circulated through the blood. Try to understand. Central kapha is damaged. Am I right? Sarakitta Vibhajan is not proper. Ama is there. Right? Ama is mixed in the blood. Am I right? Blood is circulating throughout the body. So that ama, as the opportunity gets, he gets exposed to that particular part. And in that way, it is get exploited in the chest. Do you understand? Because Ayurveda says that Vikrut Kaf, Amotpatti and Vimarga Gamana. What is that Vimarga Gamana? Carrying of ama through the blood to all other parts of the body. To all other parts of the body. Then you will ask me, sir, okay, ama is circulating in the body, that I agree. But then why not it is getting problem to my leg? Why not it is getting problem to my brain directly? Because there is a Stroto Vaigunya in asthmatic patient. Where? In the respiratory tract, in nose, in pharynx, in trachea, in bronchi. And naturally, any enemy will attack. Where it will attack? Weaker part. If your legs are strong, why it will go to there? If your brain is strong, why it will go there? So in asthmatic, we are talking only asthma. So Kledak Kapha, Amotpatti, Vimarga Gamana, circulation through the blood, and where it is getting attacked? In the chest region, because there is a Stroto Vaigunya. I hope this Ayurvedic concept is quite clear right now, because it is not described in such a way in the textual books. Okay? How Stroto Vaigunya is there? Pranava Srotas, according to Ayurvedic language, there is a Rauksha, dryness is there. Kathinya, Rauksha, dryness. Kathinya, stiffness. Kathinya is a stiffness, and Sankocha, narrowing. So there is a dryness, there is a stiffness, there is a narrowness. All respiratory tract, all the passages, trachea, bronchi, bronchioles, everything there is a dryness. Everything there is a stiffness, no elasticity, no contraction, relaxation. That is called as a Stroto Vaigunya. So in Pranava Srotas, there is avarodha plus sanga. These are the Sanskrit words. Avarodha and sanga. Avarodha, why avarodha? Obstruction. Why obstruction? Passage is narrow. Passage is dry. Passage has no flexibility. So there is a blockage. And what is blocking? That ama circulated through the blood is blocking. Where? In pranava srotas. And that is why Ayurveda has explained pratilomam yada vayuhu srotansi pratipadyate. Pratiloma, these are the specific terms of Ayurveda. I have 100 times explained that terms. Anuloma is a proper conduction of vata dosha. And I have compared vata dosha various ways. Physical, contraction and relaxation of the muscles, dilatation and contraction of the bronchi. So everywhere, neuromuscular conduction, cellular permeability. When it is in a normal way, that is called as anuloma gati. But when it is disturbed, that is called as a pratiloma gati. Do you understand? Now, when I am expiring, I have to, very easily I should throw away the carbon dioxide. But when I cannot. When I cannot throw away my expiration, then that is udana vayu is becoming pratiloma. Are you understanding my? So pratiloma vayu. Inspiration, this is inspiration. Expiration. If I problem, difficulty, I am not getting inspired not properly, that is also pratiloma. So prana can be pratiloma, udana can be pratiloma. Try to understand. Whatever the normal prana gati, anuloma gati is opposite of udana gati. Do you understand? Udana is controlling expiration and prana vayu is controlling inspiration according to Ayurveda. So whenever there is a problem in inspiration, that is called as a pratiloma of prana vayu. Whenever there is a problem of expiration, it's a pratiloma of udana vayu. I hope these things are very clear. Next, what happens? Clinical features. Ayurveda has explained. Ativa tivra vegam cha. Ativa tivra vegam cha. Shwasam prana prapidakam. These are the Sanskrit lines. Ativa tivra vega. Vega means rate. Respiratory rate is too much increased. Normal 14 per minute. It can increase up to 30. If it is more than 50, chest is silent and patient is unable to speak, adult person, unable to speak a sentence because of the dyspnea. If a small child is there, he is unable to suck breast milk because of the dyspnea. Admit the patient. So these are the criteria for admission. Remember my words. Ativa tivra vega. How you can define? Number one, respiratory rate more than 50 per minute. Patient, adult patient is so breathless, so dyspneic that he cannot speak one complete sentence. Adult person cannot speak one complete sentence because of a small child below 6 months, he cannot breathe and so he cannot suck the breast milk. That is a severe condition. And there is another important criteria which is not directly mentioned, is a cyanosis. Look for cyanosis, bluish discoloration at your tongue or at your fingernails, central cyanosis or peripheral cyanosis. Immediately every general practitioner should keep pulse oximeter in his practice. Pulse oximeter is a very cheap instrument and every practitioner should have that instrument to check, and easy to use. Just put that clamp in your finger and you will get the partial pressure of oxygen. PO2. Normally it should be 98, 99, 100. And as it is going down, below 90, below 80, below 70, severity is increasing. This dyspneic patient, Tamak Schwas patient, bronchial asthma patient, may have the below 70, below 80 and cyanosis, admit, immediately admit. Don't take the risk. And then you do the Ayurvedic treatment. I am saying you do the Ayurvedic treatment but in the hospital, not in your general practice. Because emergency medicines, especially emergency appliances, are not available. Hema Garbha may be with you. Trailokya Chintamani may be with you. But still, if the patient needs the oxygen, where is oxygen? You have to admit the patient and give the oxygen. So, hospital management is always support you for Ayurvedic emergency management. This is my statement. So, pratilomam yada vayu slotansi pratipadyate ativa tivra vegam cha shwas prana papidakam. Prana pida. This is the word in Ayurveda. Prana pida. Prana pida. Prana is a life. Prana is a life. Life-threatening condition can happen. Patient can die if it is not treated very well. Prana propidakam. But before that, pramoham. Pramoha. This will be the stage in the asthmatic patient. Drowsy. His consciousness will be deteriorated. He will be drowsy because of the excessive carbon dioxide or less oxygen. Then kas, another symptom, kas. He may have in between cough. Like that. Kas will be there. And how? Pramoham kasamanascha gacchati muhurmuhu. In between the attack, he may sometimes cough and also sometimes get drowsy. Okay? So, shleshmanyam uchchamanetu bhusham bhavati dukkhitaha. So, because of this thing, he will be very much anxious. Dukkhitaha means troubling, unhappiness will be there. Because of the shleshmanyam uchchamane. Shleshma will be so much there, stickiness will be there in his bronchial tree. Respiratory tract will be filled with sticky mucus. He has a lot of trouble and so he will be dukkhi. Dukkhi means unhappy. He is not happy. So when you give the nebulization, when you give him some sartan of Ayurveda and his bronchioles will be opened with Soma Sava, Kanaka Sava, he will be happy. He will be happy. If you give the sartan of Tankan, borax, Kantakari Churna, he will be happy because that stickiness will go down. Or even Lavanga Siddha Jal, medicated water with clove, also can dissolve the sticky mucus and he will be happy. Samprapti, Bhanga will be there. You can break the pathogenesis. Lavanga Siddha Jala, medicated water with clove, CLOVE. What the next symptoms? Na chapi nidram labhate shayanaha shwasa piditaha. Na chapi nidram labhate. Here nidra word cannot be taken directly as a sleep. Nidra means here they are talking about lying down on the bed. He cannot lie down on the bed. Shayanaha shwasa piditaha. Asthmatic patient get his problem worsen, more troublesome when he lie down on the bed. He always wished to get up, to sit up, to stand up, then he is more comfortable. So lying down position is not good for asthmatic patient, which is described by Charak. Na chapi nidram labhate shayanaha shwasapiditaha. Shwasapidita, Tamak Schwas patient, bronchial asthmatic patient. Then how he will be happy? Asino labhate saukhyam. Asino labhate saukhyam. Saukhya is a comfort. Saukhya in Sanskrit is a comfort. Asino. When he sits, sitting position is asina. Labhate saukhyam. He is happy, comfortable. Not happy, comfortable. Also, ushnam cha eva abhinandati. Ushna cha eva abhinandati. He is also happy with warm water, warm weather, warm atmosphere. So you make the environment little bit warm. What is nebulization? Is there nothing but the steam? Water steam is there, and you put some asthalin drops. So you can put some tulsi leaves, tulsi drops. Their drops are also available. In spite of the asthalin drops, you can put tulsi drops. My recommendation in the nebulization process. Though you do these experiments, you learn nebulization. You make a shooting of the nebulization process. So nebulization is very essential. Warm things, simple drinking warm water or warm Narayana oil, Narayan tel is available in the market. You have to make it warm in the water bath and give 1 spoon of Narayana tel every 10 minutes, warm Narayana tel for drinking purpose. There is a misunderstanding that Narayana tel is only for external arthritic problems. But simple sesame oil or Narayana tel or Shengdana tel. But better is the sesame and Narayana tel from Shatavari. Because it is anxious, so it will remove the dryness, elasticity will be increased and also warm. So there is a bronchodilation. Remember my words, hot. What is hot? Hot is for bronchodilation, vessel dilatation. Blood circulation will increase. Blood circulation will be increased and ama will be removed away. Ama will be taken away. Then, what are the bad things that are also mentioned in Ayurveda? Megha. I will read the first sloka and then we will go one by one. Megha, Ambu, Shita, Prakvatahi, Kleshmalaha, Cha Abhivardate, Sa Yapyaha Tamak Schwas. This is the line. I will read one by one. Abhivardate. Attack will be more and more. Abhivardate. Bronchial asthmatic patient will get more and more problem. Abhivardate. Number one, after Megha, after getting the black clouds in the sky. Every cloudy day will be bad for the asthmatic patients. Not for all, but some patient will be problematic when there is a cloud. Then Ambu, excessive water in many ways. That means if the patient is drinking unnecessarily cold water, that is bad for the asthmatic patient. Then even bath, taking the bath with the cold water. Ask the patient which water he is using for snan, angol, bath, bathing purpose. There are some old people, all the seasons they take the cold water for the bathing. That is not allowed. Even not for bath, but washing the face, washing your hands after the toilet. Bronchial asthmatic patients all the time should take the warm water. He should carry the thermos for whole of his lifetime. That is the best possible thing, because cold is bad. Even working occupation, if it is related with the water, that is bad for him. Fishermen, the people who are washing the clothes, that particular business is not good for the Tamak Schwas patient working near the water. Do you understand? Sheet, we have already discussed about the cold thing. Prakvatahi, exposure to the direct wind. Purvekarcha vara, the research has to be done. The wind coming from the east side, that is not good for the asthmatic patient. And Shleshmala, all the Kafakar things are bad for the. Then another line is Yapyaha. My listeners, try to understand this word, Yapya. This word is regarding the prognosis of the disease. Ayurveda says we can categorize any disease whether this is curable or non-curable. In Ayurvedic there are the Sadhya and Asadhya. These are the two main divisions. In Sadhya, curable, there are also two types. Sukha Sadhya and Krichra Sadhya. Sukha, easily curable. Your cold, your diarrhea, easily curable. Krichra Sadhya, difficult to cure. You have to take the treatment tuberculosis, Rajekshma, for 2 months, 6 months. Treatment is prolonged, difficult. Then that is a Krichra Sadhya. Hernia, you have to go for operation. It is difficult to cure. So cure has also easy cure and difficult to cure. Sukha sadhya, krichra sadhya. And then there is incurable. Incurable also two. Yapya and anupakramya. Yapya means his patient will be feel curable till he follows the instruction, do's and don'ts or pathya of the doctor. If he disregards the do's and don'ts, he will not have the control on the disease. Two important diseases like Tamak Schwas is Yapya, and then Prameha or Madhumeha, diabetes mellitus, is also Yapya. Rheumatoid arthritis is also Yapya. Till the patient follows the instruction, he is good. He stops the following the instruction, the disease will be out of control. Out of control. And last is Anupakramya or Pratyakheya. That means these diseases are really incurable, but they can be prolonged as the death. Death can be prolonged. That is called as Anupakramya. Like cancer, HIV, where there is no permanent cure is available, no reversible changes can take place, but you can prolong the death. That category is called, according to Ayurveda, as Anupakramya or Pratyakheya. Now, last 2 points. When there are another sub-classification which is not too much important for the practical purpose, but in the textual references for the research purpose, these two diseases are Tamak Schwas, Tamak, and Tamak Schwas. Tamak, Tamak. So what is Tamak? Write down the three things, plus, plus, plus. When there is a Tamak Schwas plus Jwara, that is fever, plus Murcha, that is the unconsciousness. So if these three things are together, that is called as a Pratamaka. Personally, I feel this is called as emergency in asthmatic patients. What is the emergency? Because original patient is of bronchial asthma, am I right? Tamak Schwas. But if there is a super added infection, then there will be fever. Try to understand. Note these points very carefully. I have given the title as a Ayurvedic treatment for bronchial asthma, but I have modified at the end. Today's lecture is etiology and pathogenesis of bronchial asthma. You can rectify it. This is a part 3, but part 3, the detailed topic is, you write down, please write down this topic. Etiology and pathogenesis of bronchial asthma. Ayurvedic etiology and Ayurvedic pathogenesis of bronchial asthma. So thank you very much for your patience hearing, and I wish you all the best. Take care.